Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada. Hello, everyone, and thank you for joining us for another extraordinary Action on Pain podcast. My name is Jennifer Daly-Cyr, and I'm thrilled to be here today. Recently, as I've been going back and reviewing some of our podcast recordings, I just want to say how blown away I am with how much I'm learning. And I certainly hope our listeners feel the same way. I'm joining today from Ottawa, and our special guest that'll be introduced to you in a moment. I first got to know a little bit more at the North American Pain School, where we had an opportunity to sort of be together for about a week's time, along with many others. And it was just a really enriching experience for me. So thank you for that.
And I'm Keith Meldrum. I'm the West Coast connection of this little group. I'm, for those who are tuning in for the first time, I'm from Kelowna in British Columbia. Along with Jen, I had a chance to meet our guests at the North American Pain School. It was a real special time. And I'm just reflecting back on a trip that my wife and I took a while ago where we went across Canada. And while I didn't get a chance to pop in and see our guests while we were in Halifax, I got a chance to see the beautiful city there. And as I say, we dipped our feet and the dog's paws in the Atlantic Ocean. That was a real special moment for us.
Thanks, Keith. And it was nice to see you while you were here in Nova Scotia. So I'm Virginia McIntyre, and I'm joining our two other co-hosts from Nova Scotia. And that is where our lovely guest comes from today. As I reflect, I have known this guest for probably 9 years for some time. And as I reflect back, I realized that she was probably the first academic research person that I encountered upon entering into this work, and who's really helped me build confidence in what I do. And she is really truly a profound leader, someone I admire, not only professionally, but as a person. And so I get the great pleasure to welcome Dr. Christine Chambers. And Dr. Chambers is an international leader in children's pain research and a national voice for children's health. She's named one of Canada's top 100 most powerful women. She creates connections and partners with patients to advance research, mobilize knowledge, and improve the lives of children, youth, and families. She is a professor and a Tier 1 Canada Research Chair in Children's Pain at Dalhousie University, a faculty member in the Center of Pediatric Pain Research at IWK Health Centre, and a scientific director of Solutions for Kids in Pain and the Canadian Institute of Health Research, Institute for Human Development and Child and Youth Health. So welcome, Christine. It is such a pleasure to have you here today.
Oh, thanks for having me. Really excited about this.
Oh, great. Happy to have you join us. Lots to unpack today. And if we had 2 hours, we would get into all of it. But in our short time together, we really want to get to talk to you about a few things. And specifically, we've had an opportunity doing this podcast that we've learned, and this has been really, really fascinating for me, that there's been the creation of 3 national pain research networks: the Chronic Pain Network, the Chronic Pain Centre of Excellence for Canadian Veterans, and the Solutions for Kids in Pain, commonly referred to as SKIP. These all occurred within a 3-year period, which created a significant amount of momentum in Canada. Personal aside, my bias is it just shows that Canada is leading in pain research throughout the world. And this is just an excellent example. So with that, and knowing that SKIP was one of these amazing organizations to come to the forefront, could you share some, background and information about, SKIP's sort of development and its role as to how it's contributed to the Action Plan for Pain in Canada?
Yeah, thanks. And it is interesting, right, to look back and to put into perspective the momentum and the opportunity that were created all in that very short period. But as I was kind of thinking about that, I was reflecting on what a long road it was to get to that point. So SKIP, Solutions for Kids in Pain, is a national knowledge mobilization network. We were funded in 2019 by the Networks of Centers of Excellence program, the NCE program. And this was a really unique federal funding opportunity because most of the time as a researcher, I'm applying for research grants, right? I mean, that's what I do. But this funding opportunity, actually, you weren't allowed to propose research. You could not spend any money from the grant on research. It all had to be focused on moving research into practice and moving research into policy. So that really kind of created a unique landscape for us. And our field of children's pain research, I mean, we are an area of strength in Canada. We have some of the world's best researchers in children's pain based in Canada. And in fact, way back in 2012, there was a state of science report that identified that pediatric pain was a world leading, international cluster, that we were publishing more of the world's share of publications on children's pain than any other country in the world. So SKIP really was kind of a growth from that. And just to give you some perspective on how long I've been doing this for, I started my research career in children's pain as an 18-year-old summer student in 1992 at the IWK. And so I always wanted to be a child psychologist. The one child psychologist at Dalhousie at the time in the Department of Psychology was studying children's pain. And that's kind of how I fell into it. And so I've stayed on that path. I did my PhD at UBC. I came back to Dal. But, what really kind of triggered the need for SKIP was really a personal reflection that even though I dedicated my whole career to publishing great science about children's pain, the goal had always been to help children, right? I thought this science would actually be helping children. But when I had my own 4 kids, I very quickly realized that all this great evidence that I dedicated my career to, publishing in journals, presenting at conferences, wasn't getting used to benefit my own children. And so that was kind of the foundational pieces of what led to SKIP, what led to the application for SKIP in collaboration with colleagues across the country. And, gratefully the funding and support from 2019 on.
That is amazing. And just one thing that twigged in my mind is you talked about the translation of, the evidence into practice. Now, there's a study, and I think it's a basic science study. I don't know. It probably needs to be redone. It talks about research takes 17 years to translate to clinical practice. I'd love to see that study redone. But so it sounds like the focus of SKIP is to shortcut that time period to get it into clinical practice much sooner.
Yeah, totally. And, when you think of 17 years, and I agree with you, that analysis needs to be updated.
Mm-hmm.
Hopefully we've improved since
Yes.
then. But, for those of us in pediatrics, like 17 years is an entire childhood, right?
Right.
Like it's an entire generation of kids who miss out on knowledge that we already have. So it was really exciting, but also scary. I mean, we know how to do research. The art and the science of moving research into practice and policy is a bit different. But it was wonderful to get this, support, to be able to build this team, this network across the country. I mean, patient partners, families have been such a critical part of what we do. And yeah, we released in 2023 the world's first national health standard for children's pain. And that was expertly chaired by Katie Burney, who's part of SKIP. So we've been able to really set the bar higher for kids in pain.
I find it interesting too how, like you said, that 17 years, how through social media, you're getting information out there for people like me, people who have children about pain and about pain care. And it's really taken off. And I think not only taken off getting it out there on social media, other people doing the same, saying there's other ways to get it out instead of just publishing a paper.
Yeah, and social media was such a critical start to our work even before SKIP. So one of the first projects that I led that was sort of more in this knowledge mobilization space was just a very simple 2-minute YouTube video that we released in 2013 as part of the fellowship I did in media and advocacy, the Mayday Pain and Society Fellowship. And my goal was that I wanted to reach parents with evidence about children's pain. And so we released this YouTube video in which a little girl shares tips with parents about what they should and shouldn't do when their kids are going for needles, all based on research. And that YouTube video, really took off, but also made me realize the importance of partnership and working with others. And so that video led to a CIHR-funded Knowledge to Action grant for an initiative called #It Doesn't Have to Hurt. And that initiative, really kind of started to put us on the map for knowledge mobilization. It kind of went viral across Canada that year, where Canadian parents became the primary kind of disseminators about evidence related to their children's pain. And so that was 2015, 2016. We partnered with Erica M's Yummy Mummy Club. If you grew up in the 70s or 80s and 90s like me, you'd remember her from Much Music. But she helped us kind of market research evidence in engaging and creative ways to parents. And so that was an incredible project. It just really kind of changed my whole perspective and approach. But it also made me realize that, it is important to empower and engage with patients and families, but it's not fair to expect them to change the system on their own. And so that's really kind of how we laid the groundwork for SKIP, which is, the problem of improving pain management on all of us at every level, and that there are important systems drivers and supports that need to be in place. And so that's where SKIP kind of, you really scaled up. It doesn't have to hurt. We still use the hashtag on our social media. It's kind of a rally cry, but we're able to develop tools and fill gaps and help coordinate others to make sure that, children's pain is being managed properly and is made a priority by everyone, not just the children and families
I
themselves.
just absolutely love that. And I want you to know, I can't even count how many times I have asked people, like in the healthcare, in the pediatric area, if they have heard your video. And for those who by chance haven't, make sure to talk about it doesn't have to hurt and the whole principle behind that. Because well, my children are older now, but they did go through the pediatric system. And I didn't know that at the time. I didn't know what I didn't know, right? And so it's a really, like you say, it involves everyone. It's everyone's challenge to make it as best as possible. So that's fantastic. Well done. It's very exciting. I also have heard about an initiative called Best Brains Exchange in collaboration with the Canadian Pain Task Force meetings in Nova Scotia in 2020.
Christine, I had shared this with Keith and Jennifer about this wonderful event we had. Was it over 2 or 3 days? And it was the first time. And I remember me reaching out to you, and I spoke at one of these, the Best Brains Exchange or the Canadian Pain Task Force meetings, and opened it up with my story. And I said, okay, I'm putting it out there. My first time, I'm putting the whole thing right out there. And I did. And it was something to really go out there. But these meetings, these were a part of the building block for the Canadian Pain Task Force and for the action plan for pain in Canada. I mean, this all happened here in Nova Scotia. And to share a little bit about this role that SKIP and that had with doing this and helping this happen.
Yeah, so I remember that Best Brains Exchange event very vividly. Virginia, you were so powerful and brave to share your story. But also, I think it was one of the last in-person meetings I attended before COVID hit, because it was like January 2020, right? So it was very memorable for a number of reasons. But yeah, so the Best Brains Exchange program is a knowledge sharing event that's actually funded and supported by the Canadian Institutes of Health Research, where I also have a role as a scientific director. And so CIHR provides kind of the infrastructure and support to develop these events that are intended to bring researchers, clinicians, policymakers, other interest holders together to discuss evidence and identify actionable solutions for complex health issues. And pain certainly is one of those complex health issues. And the way it works is that actually policymakers themselves have to request the event. So it has to be a topic that, say, our colleagues at Health Canada or the Public Health Agency of Canada or provincial policymakers, which is what happened in the case of the BBE in Nova Scotia about pain in 2020. They have to make the request to CIHR and put a topic on the table. Like, we are policymakers. We need, CIHR's help to bring together experts and to summarize evidence for us. And so colleagues through the Nova Scotia government put together this request in collaboration with what was Nova Scotia Health Research Foundations at the time for BBE. And so, yes, we hosted this, and the goal was to inform a provincial pain strategy in the province of Nova Scotia. And SKIP, I kind of partnered and provided some of the backbone support. And then, yes, the Canadian Pain Task Force kind of added on to this, and we're able to use this as an in-person engagement opportunity to inform what was the development of their incredible series of 3 reports. and the Action on Pain sort of foundation. But I think it's just a great example of how different partners in the system can play a convening role, how these events help bring different perspectives together. And even though we at SKIP, our focus is children's pain, but being a child is not something we think about in isolation. Children live within families. We know that children who have pain, 2/3 of children with chronic pain become adults with chronic pain. Children who have pain are more likely to have parents who also have pain. And we also feel very privileged to be able to be leading this work from Nova Scotia. We feel a sense of opportunity as well as like obligation to be able to leverage our platform, not just to help kids across the country, but also to help raise the bar for pain management for adults, because we know that when we're all raising the bar collectively for everyone who has pain, everyone benefits. And I know that we've been really pleased to hear that our pediatric health standard has sort of served as the inspiration and impetus for the creation of an adult pain standard. So I think it's a good example. There have been many ways we benefit from things that are happening in the adult pain space. And that kind of collaboration and connection is just so important.
Amazing. And you know what strikes me listening to you about this, Christine, is that, it's phenomenal that, within pediatrics, there's a focus on pain, identifying pain, how it's treated, and so on, because ultimately, as you say, that becomes an adult thing. And something that we hear a lot about, and certainly I was witness to this a number of times in terms through my own children, was that transition from pediatric to adult care. And can be a really awkward one, especially if there's a complex disease like pain. And so you kind of end up in some kind of void in there. So having prepared the pediatric community, their parents, and the children themselves in that regard probably equips them a whole lot better to be able to make that transition effectively. Is that a fair assessment, do you think?
Absolutely. And I think, that's why it's
Mhm.
so important that we collaborate and engage with our colleagues, outside of pediatrics, because the transition issues across pediatric health issues and healthcare are a challenge. And, chronic pain is one of those. And I also think, when someone realizes that their pain can be better managed, whether that's as a child or an adult, it changes the expectation. And I remember always being, Virginia, what like you just don't know that it could be done differently. And I used to always marvel at like the research on hospital satisfaction rates, that patients, upon discharge from hospital will report very high levels of satisfaction with their care, even when they've had very severe levels of pain. And I've always kind of interpreted that as people think that experiencing severe pain is part of healthcare, right? Like they assume I've had surgery, so I should have a lot of pain. And so, I think that when we show people in whatever setting, and, whether it's for routine vaccinations for your infant, that there are things you can do, it does change the lens through which people approach their healthcare encounters. And so I think that's another thing that we can do. When you experience proper pain management, you can help demand it, expect it, and normalize that through other healthcare encounters.
That's a very strong comment. And I'm just going to share just a little bit sort of my own personal experience because it just hit me when you said that. So my introduction to pain was I was at the tail end of pediatrics. I was 16, had a fairly traumatic car accident that was nearly fatal. And this is 1986. After the initial surgery of 7 hours, the surgeon comes out and says to my parents, so this is the beginning of the transition from acute to chronic. They say to my parents, he's going to live, but he'll have problems later on. That was it.
Ugh.
That was it, right? And my parents who were young and they're just like, so looking back on it now, seeing what Skip does, like this just reminds me of just how important it is, the work that you do to lay that foundation for here's what the issues are, but here are the things that you can do with it. So, I mean, and we've heard, through this podcast and our individual advocacy work, Skip is well known internationally for what you
Yes.
do. Like you said, it's the foundation for the adult health standards, which is now under sort of its beginning stages. Personally, I'm just so proud of the work that Skip has done and just how much it supports, pain in Canada. So it's incredible.
Oh, thank you. And, when I hear people say that, it makes me feel really proud, right? And I think, one of the things that we really try to do with Skip is, a network needs to be more than the sum of its parts, right? I mean, a colleague of mine said that to me at the early stage of Skip. He's like, you really have to think of what can the network do together that could not be done, in isolation. And so when I hear that feedback, it really does make me feel proud. And we hear, it's interesting, the health standard, for example, even though it was developed to improve care in Canada, our funding from the networks of centers of excellence was to improve children's pain management in Canada. So we didn't have an international mandate, but it's been downloaded in over 80 countries around the world.
Unbelievable.
Without any deliberate international kind of promotion or dissemination. And so it is the world's first national health standard. And again, I just want to emphasize what an incredible job Katie Burney, who's an associate professor at the University of Calgary, did chairing this working group, the whole group. I mean, it was a massive team effort, the Health Standards Organization, an incredible partnership. But yes, so I think it is raising the bar. And Skip right now, we're no longer funded by NCE. Our funding ended. The NCE program has been sort of sunset, but we have some kind of ongoing support from the university here at Dalhousie, but also from other funders. We have an opportunity to be more, I guess, deliberate in some of our international engagement now. And yeah, so it's an exciting time for Skip. We recently released a new strategic plan. Yeah, just a map out a course forward. And yeah, we're very focused now on implementation of the health standards. So it's great to create these standards, but how do we make sure we actually use them and support people in using them?
That's incredible. And 80 downloaded in 80 countries worldwide. I mean, that's
incredible.
It talks about the no silos, the collaboration, the partnership. And as someone who runs adult organizations, people in pain now, people say, why are you, like, I didn't expect you to see it when I was at strategic meetings and stuff. I said, because, we have young adults who have had been pain, or adults have pain, or have children of pain. I said, it's these collaboration and partnerships that help us all become more aware and move things forward.
You made a really great comment. You talked about, somebody had said that, organizations need to be greater than the sum of their individual parts. And I mean, I think Skip and the work that you and others have done has just really, exemplified that, which is focusing on what the goal is. And in this case, it was about children and addressing that. And, so people park their egos, they park their individual sort of goals. And when you come together, incredible things happen. Like, I am just so proud of Canada and the work that we do on the pain stage. But with the pediatric pain, it is just amazing, all the work that Skip has done. And just, again, makes me to be very proud to be a Canadian.
So we would like to thank Dr. Chambers for being here today and sharing her time and expertise with us. We certainly hope you will come back again, Christine.
Love what you're doing, and thank you for helping to spread and share this important message and messages around pain.
And we'd like to thank all of our listeners for tuning in to the Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada, as guided by Health Canada's An Action Plan for Pain in Canada. Until next time. Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.